Your Health First TV. Our mission at Your Health First TV is to provide legit, reliable, and up-to-date health and medical issues to the general public. We are here to educate viewers about varieties of health-related topics, including disease prevention, treatment, and recovery. We do this by using several languages to pass health-related information. Your Health First TV drives you to a better health.
Welcome to your Head First TV. Today we are going to talk about misconceptions preventing some people from accessing modern medical care in Nigeria. Before I go on, I would like you to know the meaning of misconception. Misconception refers to incorrect or false beliefs, ideas, or opinion about something. Let's narrow it down to the topic: misconception preventing people from accessing modern medical care in Nigeria. This refers to incorrect or false beliefs, ideas, or opinion held by people when it comes to matter of accessing medical care in Nigeria. This misconception arises from misinformation or incomplete information. This incomplete information can be gotten from social media, it can be gotten from words of the mouth, it can be gotten from cultural norms. There are bad effects of these misconceptions in our society, in that it can lead to phobia or fear of hospital. It can lead people to accessing wrong treatment for some diseases. For example, in our rural setting, when someone begin to have bilateral leg swelling, what we refer as swelling in both legs, associated with difficulty in breathing, the first place the person will present is to a traditionalist. They will think it is poison. The traditionalist may decide to use sharp object piercing the leg with the aim of letting bad blood that causes the leg swelling to flow out. In the course of this treatment, the disease may get worse, only for the person to present to hospital when his or her life is already in danger. These are the possible effects of these misconceptions. Then let's hear most of those misconceptions that our people have that makes them not to access medical care, especially when they are sick. One, our people believe that medical care are not necessary for minor ailments. What are minor ailments? Minor ailments are those common non-serious type of diseases which can be cured by over-the-counter medication, self-care, or advice from a professional health workers. These ailments include headache, there can be cough, there can be cold, there can be constipation, diarrhea, there can be heartburn, and the rest of them. In our rural setting, most of these ailments are cured by self-medication. But may I tell you, most times, this ailment can be a symptom of an underlying diseases. For example, headache can be a symptom of brain tumor, it can be a symptom of other serious neurological disease. Then heartburn can be a symptom of peptic ulcer. And you know, untreated peptic ulcer can give you gastric adenoma, commonly called gastric cancer. Then heartburn can be a symptom of gastroesophageal reflux disease, or it can be a symptom of another gastrointestinal diseases. Then let's liken our body to a motorcycle. When a motorcycle begins to produce a black smoke, there is an indication that something is wrong with the carburetor. If the owner notices and cares, he can take the motorcycle to a mechanic who will detect the fault and help fix the motorcycle to its normal state. But if he notices and doesn't care, the production of this black smoke can progressively lead to the complete breakdown of that motorcycle. This is how our body works in reality. If we notice any deviation from the way our body works, it is advisable that we present to a medical doctor. This medical doctor is going to assess what is happening to our body and through proper medication help restore our body to the normal state. There is no disease condition that is too small that they cannot seek medical attention. Another misconception that our people have, they believe that traditional medicine are more effective than modern medicine. What is traditional medicine? Traditional medical practices involves the use of herbs, acupuncture, and other traditional practices in the prevention and treatment of diseases. Yes, these traditional practices may have some benefit in that they are natural and non-invasive. They are also cheaper, but all these benefits cannot be compared to the benefit gotten from modern medical care in Nigeria. Note, the herbs used by most traditionalists are very, very injurious to our body. Some of them can cause kidney diseases and then kidney failure. And then kidney failure can lead to someone's death. Another one is that the herbs lack dosages. They lack the dosage necessary to bring the desired result. Most times when they administer those drugs, it can go a long way to affect other parts of our body. Then, another misconception that our people have is they believe that hospitals are meant for the wealthy people. No, hospitals are meant for everybody, and everybody has equal rights when the person accesses the hospital. Another misconception our people have is that they believe that most diseases are caused because the gods are angry. Yes, countless times I have heard people say that most diseases are caused because the people fail to appease the gods, or because people fail to honor one's dead parent. This is common in our rural areas. But how true is this? I may not have specific answer to it, but I want to advise you, if you are having any sickness, it is advisable for you to present to a medical doctor first than staying back and blaming the gods for the cause of your sickness. Another misconception that our people have is that they believe that medical practices or medical care are very, very expensive. Yes, there are many medical practices that are very, very expensive, but there are ones that are cheap, especially in government-owned hospitals, that are affordable for everybody to access. It is very easy to access medical care in Nigeria these days, in that if you go, there's always be a way out for you to pay yourself at the end. Then another misconception that our people have is that they believe that traditional birth attendants are more safer than hospital deliveries. This myth has killed many of our pregnant women in our rural areas. They believe that the services of a traditional birth attendant are safer than that of the hospital. Most of them end up giving birth to children with deformities, with limb bones. Some of them will give birth to children that don't walk normal. These are what we see in rural setting. But let me tell you, most of those traditional birth attendants, their pattern of assisting women to delivery is not good. Most of them will sit on the belly of a pregnant woman during the course of labor, telling the woman to push, push, push. In the course of pushing, most of these women get tired, go into coma, and then die at the end. Sometimes you even lose the baby and the mother, but this is not so with hospital. Hospital has equipment that is necessary or that is available to assess the state of the mother, to assess the position of the baby, to determine whether the mother has the strength to undergo vaginal delivery. It's advisable if you're a pregnant woman that you prioritize your antenatal in a good hospital. Another misconception that our people have is that they believe that madness is caused as a result of demonic possession. How true is this? I want to hear your opinion in the comment section. But may I tell you this? There are parts of the body that control all other parts. This part of the body is called the nervous system. The nervous system consists of the brain, it consists of the spinal cord and the nerves. The nerves are like wires that connect the brain, the spinal cord to other parts of the body. There's part of the brain that controls conscious effort. Maybe if I want to talk, it will be initiated in that part of the brain, and the brain will secrete what we call neurotransmitters. These neurotransmitters will travel through that wire-like structure called neuron to the effector muscle, which may be the muscles in my mouth, and it will contract and I will talk. There are possible cases that will lead to the malfunction of these neurons. There are possible cases also that will lead to the increase in these neurotransmitters. Increase in these neurotransmitters can lead to hallucination. Someone will begin to see an inanimate object as animate. That's why you see mad people talking to rivers, talking to grasses, because there may be high level of these neurotransmitters. There are other factors that may cause madness, like genetic factor, environmental factor, trauma, and to mention but a few. If you have any mad person around, it's advisable that you present to a psychiatric doctor who, by careful history taking, can establish the cause of the madness and then initiate possible lines of treatment. Madness is not cured by beating the person. Thank you for watching with us. Know that this information that you heard came to you from your Health First TV. And for your feedback or for your counseling, you can contact us via WhatsApp only through 090-182-62823. Your Health First TV drives you to a better health. Thank you.